Welcome to this video on bone metabolism for hand surgeons. This video was produced by Roberto A. Miki, MD. Help support this channel. Remember to like and subscribe. We begin by reviewing the three main bone cells. Classically, medical schools have taught that the osteoblast formed bone, the osteoclast resorbed bone, and the osteocyte maintained bone homeostasis. The understanding of the role of osteocytes and the interaction between cell types has advanced tremendously over the last 20 years, and is much more fascinating and incredibly interweaving. Let's get into it. 3 drugs for osteoporosis, Romosozumab, Denosumab, and teriparitide, give insight into 3 important bone metabolic pathways. Romosozumab's story begins in an unlikely place. South Africa. There are families of Dutch ancestry there who have extremely dense bone. 5x denser than you and me. The mutation was likely brought by an unsuspecting Dutch immigrant, because the condition is predominantly found in Afrikaners in South Africa. Sclerostiosis gives us insight into the function of osteocytes and the sclerostin bone metabolic pathway. Sclerostiosis is an autorecessive disorder, first described in 1958. It involves the SOST gene and is radiographically similar to osteopetrosis, but the bones are not brittle. Sclerostiosis is caused by a mutation which leads to the loss of function or complete absence of sclerostin. To understand the role of sclerostin, we have to review bone formation. Bone formation starts with osteoblast precursors differentiating into active osteoblasts, which form bone matrix. Osteocytes produce sclerostin, a protein that inhibits the differentiation of osteoblast precursors and function of osteoblasts to reduce bone formation. In a state of decreased mechanical loading, the production of sclerostin is upregulated, leading to decreased bone production. Conversely, increased mechanical loading decreases sclerostin production, resulting in increased bone production. Hence, sclerostin is part of a feedback loop, which allows bone to respond to forces placed upon it. Sclerostin is a key protein in a pathway responsible for Wolff's law, which states bone grows when placed under stress and weakens when not stressed. Romosozumab is an FDA-approved anabolic drug for the treatment of osteoporosis. It is an antibody that binds to sclerostin, preventing its interaction with receptors and thus increasing bone production. The drug mimics sclerostiosis and loading of bone. Romosozumab and the sclerostin pathway have been studied extensively. Some of the experiments were even completed at the International Space Station. Romosozumab was found to protect from bone loss from disuse, from unloading, in the case of forcing a rat to walk on its forelimbs, or in the case of a rat going to space. This ends our story about sclerostin and osteocytes, but another pathway called rank/rank ligand gives insight into the interplay between osteoblasts and osteoclasts, which superficially you would think should have no interaction. But bone remodeling is a balance between bone formation and bone resorption, so it makes sense that there would be a link between the two processes. Through most of our lives, the two are linked and balanced. During growth and disease states, they can become uncoupled. The story of the connection between osteoclasts and osteoblasts begins with osteoclast formation. The osteoclast maturation pathway begins with a macrophage, which differentiates into an osteoclast precursor, a multinucleated precursor, and finally an active osteoclast. Rank ligand is produced by osteoblasts and binds to rank on osteoclast precursors, leading to osteoclast formation, activation, and bone resorption. Osteoprotegerin, or OPG, is also produced by osteoblasts and inhibits rank ligand signaling by binding rank ligand, preventing osteoclast differentiation and subsequent bone resorption. Similar to OPG, Denosumab works by binding to rank ligand, preventing it from activating the rank on osteoclast precursors, thereby inhibiting osteoclast maturation. Denosumab is an FDA-approved antibody for the treatment of osteoporosis. Another key player in bone metabolism is parathyroid hormone. In the parathyroid hormone and bone metabolism pathway, low blood calcium triggers PTH release. Continuous PTH increases rank ligand expression and decreases OPG production. This promotes osteoclast activity, leading to bone resorption and increased blood calcium. Teriparitide is an FDA-approved subcutaneous daily injection for osteoporosis. It is the first 34 amino acids of PTH. Teriparitide administration is intermittent and does not maintain continuous levels of the drug. In contrast to continuously elevated PTH, intermittent teriparitide binds to receptors on various bone cells, decreasing sclerostin and increasing osteoblast activity, ultimately resulting in a net increase in bone mass and density. In particular interest to hand surgeon or any orthopedic surgeon dealing with bone healing, teriparitide was found to statistically significantly decrease time to healing for distal radius fractures. The differences was only 1.7 weeks, which is clinically irrelevant, but a non-union or slower to heal bone, such as a subtrochanteric hip fractures, could theoretically benefit from an off-label use of teriparitide. Thanks for watching. We hope to see you at the next video.